So let's talk about bronchodilators. Now, bronchodilator action is limited to taking that constricted, inflamed airway and opening it up. The drug binds to the beta-2 receptor in the lung, and it stimulates cyclic AMP in smooth muscle cells. Those smooth muscles relax in the bronchial muscle, and you get dilatation. Now, obviously, you're not fully treated because those airways are still kind of thick, aren't they? Short-acting beta agonists generally last less than 6 hours, such as albuterol. Long-acting beta agonists, or LABAs, act for over 24 to 48 hours, sometimes 12 hours. These are salmeterol, formoterol, and so on. Those drugs are used once or twice a day. Now, there is a drug specifically indicated for COPD that is also in the beta agonist list, but we're going to leave that alone for now. Toxicity of bronchodilators is pretty rare. You can sometimes get tachycardia or tremor, and sometimes you can get hyperexcitability, but as I said, because these are inflamed agents, you're not really going to have a lot of symptoms. Methylxanthines are purine derivatives. Now, caffeine is a methylxanthine. So when you think about effects and side effects, think about caffeine on your own body. Theophylline is the prototypical respiratory methylxanthine. These drugs act by inhibiting phosphodiesterase, and PDE3 activates bronchodilation. When you have these drugs on board, you may also increase diaphragmatic strength. 2 cups of coffee can actually cause bronchodilation, so you can understand that these drugs may be quite potent. The side effects are the same as drinking too much coffee: gastrointestinal distress, usually manifested by cramping, tremor, and insomnia. A toxicity of these agents can be arrhythmia and low blood pressure, and vomiting is also a potential side effect. The antidote for these medications is beta blockers, because you want to block the effects of hyperadrenergic states. The next class of drugs are the muscarinic agents. The prototypical drug is ipratropium, which is sold commonly as Atrovent. When you look at the color of puffers, its universal color is going to be green, or a green cap. This agent will block muscarinic receptors in the airways. These prevent bronchoconstriction caused by vagal discharge, so they may not be particularly effective if they've already constricted. They may be used both in children and in adults, and these agents have no anti-inflammatory action. The toxicity is minor atropine-like effects, so the toxicities are almost non-existent. They do not cause tremor, and they do not cause arrhythmia, which distinguishes these drugs from the beta agonists.